Bronchiolitis. The name might sound complicated, but it simply refers to an infection of the small airways in the lungs, called bronchioles. It's a common respiratory illness, especially affecting infants and young children under the age of 2. This video will walk you through everything you need to know about bronchiolitis, from its causes and symptoms to treatment and prevention. The most common culprit behind bronchiolitis is a virus, specifically the respiratory syncytial virus, or RSV for short. RSV accounts for the majority of bronchiolitis cases. Other viruses, such as rhinovirus, adenovirus, influenza, and parainfluenza viruses, can also trigger this condition. These viruses are easily spread through respiratory droplets, like those produced when someone coughs or sneezes. Touching contaminated surfaces and then touching your face can also lead to infection. So, what exactly happens inside the lungs during bronchiolitis? The viral infection causes inflammation and swelling of the bronchioles, the tiny air passages in the lungs. This inflammation leads to a buildup of mucus, further narrowing the airways. As a result, it becomes difficult for air to flow freely in and out of the lungs. This trapped air can lead to wheezing and shortness of breath. In severe cases, the inflammation and mucus can significantly impair oxygen exchange, leading to low oxygen levels in the blood. Bronchiolitis is incredibly common, especially during the fall and winter months when respiratory viruses are circulating more actively. It primarily affects infants and children under 2 years old, with the peak incidence occurring between 3 and 6 months of age. Almost all children will have had bronchiolitis at least once by the time they turn 2. While generally mild, bronchiolitis is a leading cause of hospitalization for infants, particularly those with underlying health conditions. The symptoms of bronchiolitis usually start like a common cold, with a runny nose, mild cough, and possibly a low-grade fever. After a day or two, more characteristic symptoms develop. These include wheezing, a high-pitched whistling sound during breathing, rapid breathing, also known as tachypnea, difficulty breathing, which may manifest as retractions, where the skin between the ribs pulls in with each breath, a worsening cough, and irritability or fussiness. In severe cases, you might notice bluish skin around the lips and fingertips, a sign of low oxygen levels requiring immediate medical attention. Diagnosing bronchiolitis usually involves a physical examination by a doctor. They will listen to the child's lungs with a stethoscope to check for wheezing and other abnormal sounds. The doctor will also assess the child's breathing rate and effort. In most cases, no further testing is needed. However, in severe cases, a doctor may order a chest X-ray to rule out other conditions like pneumonia. They might also check oxygen saturation levels with a pulse oximeter, a small device that clips onto a finger or toe. While there aren't distinct types of bronchiolitis, the severity of the illness can vary significantly. Bronchiolitis can be categorized as mild, moderate, or severe based on the severity of the symptoms, such as the degree of breathing difficulty and oxygen saturation levels. This classification helps guide treatment decisions. The primary focus of treatment for bronchiolitis is supportive care. This means making sure the child is comfortable and breathing as easily as possible. Common treatments include nasal suctioning to clear the nasal passages of mucus, ensuring adequate hydration by offering fluids frequently, and monitoring oxygen levels. In severe cases, hospitalization may be necessary for oxygen therapy or even mechanical ventilation to assist breathing. While bronchodilators like albuterol are sometimes used, their effectiveness in treating bronchiolitis is debated and varies from patient to patient. Antibiotics are not effective for bronchiolitis, as it is a viral infection. The doctor will determine the most appropriate plan according to the severity of the illness. Preventing bronchiolitis involves minimizing exposure to respiratory viruses. Frequent hand washing with soap and water is crucial, especially after touching surfaces in public places. Avoid close contact with individuals who are sick with colds or respiratory infections. If you have a cold, cover your mouth and nose when you cough or sneeze, and wash your hands frequently. Braced feeding can also provide some protection against respiratory infections. For high-risk infants, such as premature babies, there is a preventative antibody called palivizumab, which can help protect against severe RSV infection. The prognosis for bronchiolitis is generally excellent. Most children recover fully within 1 to 2 weeks. However, some children may experience persistent wheezing or cough for several weeks. Bronchiolitis does not typically cause long-term lung damage. Research is ongoing to develop better treatments and prevention strategies for RSV and other viruses that cause bronchiolitis. Areas of investigation include new antiviral medications and improved vaccine candidates. These advances will hopefully lead to even better outcomes for children with bronchiolitis in the future.